Yeah, FormFast has been a great partner to work with over the years. I think the education and training has been very good.
What FormFast has done is they've collaborated with our IT department to identify areas where we can improve patient relations and ease of registration, making sure that we're capturing the information that we need so that when people check in and they're maybe a little apprehensive because they're coming for a physical or to see a specialist, or perhaps they're getting admitted into the hospital, people are nervous and really don't want to spend a lot of time filling out forms. So being able to facilitate an easier registration process and making sure, again, that we have the information that we need to appropriately diagnose and treat patients, it's integral to having an effective healthcare system.
Yeah, so at the time of the patient's registration within Meditech, the registration clerk is able to click a button within Meditech to launch FormFast. FormFast launches, and then we're able to capture the patient's consent.
The patient response has been very positive, and I think in healthcare, patients expect a lot of technology, and just the fact that you're using electronic products gives them the perception also that we're organized, we're efficient, we're accurate.
With the Go application, it's been great because we can scan the patient's wristband, get a positive match on the patient. The consent for procedure can pull up. We can capture a consent and signature right in the room with the provider, and then that document goes straight to our legal record. So we are seeing some time savings of anywhere between 5 and 10 minutes where a staff member would have normally had to take that paper document, fill it all out, get the signatures, and then go back to our legal record and manually scan that document back in. It could be a couple days before we could get those necessary documents into the patient's legal record.
From an enhancement standpoint, we've been able to bring data out of Meditech in a way that we like to view it or use it. So being able to use some of the FormFast tools and technology to bring out additional data, format it differently, make it more useful for that end user, has significantly helped out our processes here.
At Broadlawns previously, when we had a paper consent, it would get scanned in under a very generic heading of consent for procedure. So every consent that was in a patient's chart, if they had 10 different consents, they would all say consent for procedure. When we set up FormFast, we tied it to a heading in the background for their clinic or their area. So then it would say consent for podiatry procedure, consent for OB procedure, so that it was easier to find in the chart down the line.
The product itself is easy to use. We were able to train the staff quickly within a matter of 20 to 30 minute time span. So on the same day as the training, the clinic was able to get it up and actually using it.
We've rolled it out to several clinics, and I feel like the clinics that have utilized it the most have been the ones that do a lot of procedures, either in the clinic and also pre-op consents. And the physicians like it because they don't have to rewrite things and repeat, spend time on consents on paper before they give it to the patients. They're confident that when they pull up their consent, it has everything in the consent that they want in it. It's easy to explain to the patient, and then they can complete the consent quickly.
At the end of the day, this will not only help their workflow, but also increase patient face-to-face time. I think it's going to be one of the key resources.
They're good to work with. They understand, being that I have a nursing background, they understand that I'm not a computer programmer, and they could relate to me as a clinician as well as a clinical analyst. So I felt they were very helpful when we needed it.
It certainly has shown that the forum being so successful here at Broadlawns only represents how successful FormFast is.
It just increases the efficiency and the accuracy, and I think in healthcare that's very important. It's certainly important to us here at Broadlawns. It's kind of that sweet spot of healthcare of being fast and accurate and efficient. Nobody likes waiting, nobody likes being slowed down. So when you have something that helps you improve your clinical practice and streamline it for both the clinicians and the patient and the office staff, I think it's a benefit for everyone.